Frontiers Health 2025 with Eugene and Marina Borukhovich, the co-founders of YourCoach.Health. You guys just got off the stage talking about your company and about humanity as a feature, not a bug. Tell me a little bit about this idea and how it relates to what you were talking about in integrating AI in your work in YourCoach.
Well, we get asked this question all the time, several times a day, on a good day, on a not so good day, dozens of times. And it's about how are you using AI? And our hypothesis has always been we're augmenting humans, we're not replacing them. AI, it has a place, absolutely, and would be crazy not to say that, but we've said that since day one of YourCoach. We are using AI to augment coaches. It's for safety, it's for unit economics for us as a business, and it's for quality of those conversations.
You know, and I think, if we kind of rewind back even the last decade as we're here at Frontiers, there's been so many, I'll say, tremendous technological changes. And I think, we've been talking about, as a society, about access. And we strongly believe that AI is here to provide and give more access. But also, we need to not forget about that human connection. And, ultimately, you can't feel what that patient, individual, employee says if you're AI. You can't feel it. There's no true empathy. And as you're going on that journey for behavior change, you really need to understand that there's somebody you can be accountable to, not just a machine. So.
And to help you uncover that intrinsic motivation, because at the end of the day, that's what's going to move the needle.
You founded your company, you launched it here at Frontiers Health 5 years ago. What's the journey been like since then? What are some of the kind of new highlights this year in terms of some accomplishments?
All right, I'll kick us off. So obviously, I think we are going strong 28 years.
Not as a company.
Not as a company, but as a couple, and we get asked the question all the time as well, right? How is it working with your spouse? We love it. Still going strong.
I love how you're just launching into that. In case anybody wonders.
Yeah. Well, we get that asked question just like with AI, right? The second part, we kind of alluded to, obviously healthcare takes. Being an entrepreneur in healthcare takes resilience, takes a lot of pushing, right? The sales cycles, especially in B2B, are very, very long, but we're seeing the momentum, and I think it's a bit of this, I'll call it antithesis to a certain extent, where, yes, we do ask the question on AI, but I think as a human-led service, we're seeing some of that traction because people are also recognizing that it needs to be there. So we are growing fast. We're, we're kind of getting over that. We have the supply side. Now it's really execution on the commercial side.
And we love that there's appreciation now for the human in the loop, right? Because everybody just dove head deep into this like AI first, and now we're all realizing, well, we've realized this a long time ago, but it's great to see that the consensus is we do need that human in the loop.
Sometimes it takes contrast to draw attention, right? And that's what your talk was all about, all the advantages that humans bring to coaching, to care, right?
Yeah, and I just wanted to add one thing that we didn't talk about on the stage. Health coaching has been around for 20 years. I would say in the last 6, 7, 8 years, there's been actually RCTs on those intervention. It's been mentioned twice, so for the U.S. audience in the physician fee schedule. For the first time ever, it's in the chronic disease management section. The comments that they were being requested from us as a community was, should we move those temporary codes to reimbursable codes? Because I think the reality is here that there's just not enough clinical staff out there to help us as a growing, really, epidemic of everything from obesity to MSK, prevalence in cancers, but also self-paced technology is here, and we're big believers in it, but there has to be something in between. So we're seeing recognition, at least from even CMS.
Oh, that's wonderful.
Yeah.
Well, thanks so much, guys. Enjoy the rest of the conference. I know you've got a workshop tomorrow.
That's
if
right.
Folks are interested in learning more.
Sounds
Excited
great.
to be here. Thank you.
Thank you.